Is there a link to metabolic problems with viruses that cause cancer and diabetes? We now know that certain viruses cause cancer. We also know that metabolic problems suppress the immune system, allowing virus to cause cancer. Some examples are rotaviruses and enteroviruses that cause gastrointestinal problems are linked to diabetes and metabolic problems. As the kind of milk that an infant child has in the first 2 years is a factor. In type 2 diabetes, insulin levels are typically elevated, indicating there's a loss of sensitivity of the insulin to the cells and problems with the cell receptors. In type 2, there may be not be enough insulin that is doing the job of unlocking the cells to let the sugar inside cells, nor does the pancreas send signals to the liver to secrete the adequate amount of insulin needed, or pulse insulin to get the liver to also emit many key enzymes needed for biochemical pathways for proper metabolism. I cover this in detail in my first book called Find and Stop Diabetes. It's important to recognize the role that prediabetes has as well. Prediabetes is considered impaired glucose tolerance. They're higher than normal but not too high. I suggest a different category completely, which refers to metabolic impairment, since the sugar may be slightly elevated or there may be evidence of inadequate processing of carbohydrates, fats, and glucose. Diabetes is more than a sugar disorder, and that it's characterized by chemical imbalances of fat and protein. There's lesser inflammation and immune system problems. Insulin is at the heart of the diabetic order. Problems arise when the pancreas did not produce enough insulin or pulsing insulin, where the body becomes resistant to insulin and the receptors cannot take in glucose inside the cell where it's needed for energy, or the doorkeeper receptors have not allowed glucose to enter into the cell. The problem causes a serious set of problems, and that is why diabetes is such an expensive problem. Diabetes is in fact a very complicated and complex disease, and its role in inflammation, cellular damage contributing to acidosis, and other problems are reasons that diabetes and the prediabetes is also linked to increasing obesity and many cancers. Diabetes is also an autoimmune problem, and that around 80% people with type 2 have antibodies against their own cells, and even more in type 1 diabetes. These antibodies seek out and destroy damaged cells or cells that had been affected with viruses or bacteria.